Hi, welcome to Straight Talk. It doesn't matter where you live in this country. Every community is dealing with the problem of heroin addiction and opiate addiction and prescription drug problems. I don't care where you live. It affects everyone. It doesn't discriminate. Whether you're young, whether you're old, rich or poor, we are going through an epidemic in this country of prescription drug abuse that's also leading to heroin addiction. So today on Straight Talk, we're going to take the whole show. We're going to talk about prescription drug abuse, talk about treatment, talk about addiction. What can we do to help the people that we care about? And joining me is Karen Moore, who is a social worker, a therapist, and an expert in the field of substance abuse. Karen, welcome.
Thank you for having me.
You work in a program in Maryland Addiction Recovery Center. Excuse me. And you see this every day.
Every day.
I mean, it's crazy what's going on. Let's talk a little bit about prescription drug abuse, because I think some people don't understand getting a prescription and then having it become abusive.
Right.
Talk a little bit about addiction here.
Well, I mean, I think there becomes a heavy focus on opiates, right? That becomes the focus, but there are so many drugs that people are abusing. You know, we look at the ADHD medications, you know, we've got stimulants, we've got benzodiazepines, which are generally used to treat anxiety. So people will take these under the guise that, oh, okay, so it's a prescription, it's safe, a doctor gave it to me, you know, as long as I take it, it's okay. So sometimes we find that people are like, well, it's not working quite like it was, or, you know, they feel really good on it, so they take a little bit more. And that abuse of that drug, taking it not as prescribed, then can lead them into this downward spiral where they can't get off of it.
Just because it's a prescription drug, you know, people tend to think legal, illegal drugs. That legal drugs are good, illegal drugs are bad, but in reality, when you abuse prescriptions, they're addictive too. And people I don't think really realize all the ones you mentioned, from ADD medicine to, you know, tranquilizers to sleep aids. I mean, Ambien, for instance, is one that a lot of people use Ambien to help them sleep, but it's not a safe drug either.
Absolutely.
Talk about addiction when you talk about all these drugs.
Yes, I mean, it's a big thing. I mean, addiction is scary. So a lot of the drugs that people are taking, they don't realize once they start taking it. So if you take a benzodiazepine, right? You've got anxiety, you go see your psychiatrist, you're prescribed, you're like, you know, I'm having a really hard time, and you start to overtake it. And you're taking so much of it, your body then forms a dependence. And all of a sudden, you have this huge addiction. You're starting to get sick when you come off of it. And with that particular class of drugs, you can die coming off of it. You can have a grand mal seizure and die coming off of a benzodiazepine. Then with the opiates too, you find people will take them, they're prescribed, they've got pain, or they've, you know, their doctor says, you know, you come in for a back problem. They start taking an opiate and they start to really like it, because not only is it numbing the physical pain, but all of a sudden that inner turmoil that they might have, the stress of their day, they don't feel that anymore either. So they start taking more of that, and as they realize, as they're taking more of it, they gain that tolerance. It's not working the same way. They start taking more. They find ways to get more. They see another doctor. They do things that are way out of what they would normally do to get more, and then when they try to come off of it, they get really sick. And that's where you see the cycle of addiction happening. So,
is it safe to say that, let's just take painkillers, Oxycontin or Vicodins, all the ones that we hear about. Is it safe to say that if a doctor gives you Oxycontin for, again, legitimate pain, and you take it for 30 days, 60 days, are you going to be addicted?
Not necessarily addicted, but you could be physically dependent.
Okay.
Right.
Okay. And what does that mean when you say not dependent, but physically addicted?
So physically addicted means that your body will go into withdrawal. So you will start to feel sick or feel the effects of coming off of the drug if you were to just stop it. So
it doesn't matter who you are.
No.
And that's the point I'm trying to make.
That is biological.
Doesn't matter who you are, that a doctor gives you a legitimate prescription and you use it for 30, 60, 90 days, you're going to develop that physical dependence. I don't care who you are or where you are. Now, that's pretty safe to say. So
It's biological. I mean, any body is going to respond that way if you're on that medication for an extended period of time.
So let's just say somebody's watching in one of our cities, and they go, well, yeah, well, you know, I've been taking a painkiller for my back for a couple months. How do I get off?
And that's when you look to your doctor and you talk to them and you say, I'd like to come off the medication, see if there's other alternatives, and really set up a plan to wean yourself off of it. The problem becomes that there is a portion of the population where even after that process has occurred, they are craving it and they are going to look for it. And that's the scariest thing, is that people don't realize that just taking that drug and having that physical dependence begin, when they come off of it, the brain is switched and they are going to crave that drug even though they don't need it anymore.
So there we have that issue where they're still dependent even though the physical part might be over.
Right.
Because whatever happened to their brain, or as you said before, maybe it made them feel good, and now they're looking, they can't get their prescription, so then they do what? Turn to heroin. It's crazy.
Yeah.
Right. That's what
or they buy the drug, they buy the prescription drugs on the street. It's extremely expensive. It's like we watch the process happen. People usually start on prescriptions and move to heroin because it's cheaper and it's available.
So even though legitimately, and this is the important part here, they got a legitimate prescription, they got off physically, but there's some people are still dependent.
Correct.
That psychologically, that leads them to keep wanting to use.
Absolutely.
And then they start the physical part all over. You know, and then they're going to, you know. So hopefully, well, we're going to take a break, but this is fascinating because I think this is what people need to hear, because this is going on all over the country.
Absolutely. Everywhere.
This level of addiction that we're creating.
And people are dying.
Yeah, we see it every day. Overdose, more people are dying of overdose than car crashes. Unbelievable.
It's unbelievable.
Well, stay, you're going to be here, so stay. We're going to take a little break. When we come back to Straight Talk, we're talking about opiate addiction, prescription drug abuse. It's a very important topic. People are dying in this country. In the city you live in, it's a problem, and we're trying to help you understand it and try to solve it and help people that might need help. So stay with us. We're coming right back to Straight Talk.
Parents sure have their hands full, and they could use an extra hand. Now, every state offers free or low-cost health insurance for your sports hero or budding artist. Kids up to age 19 can get checkups, doctor and dentist visits, hospital care, prescriptions, and more. Your child may qualify based on your family size and income. It's one less thing to worry about. Call or go online for more information.
What about my privacy?
It's protected.
And the music I listen to? Protected.
What about how I wear my hair?
And the things I say and write?
The Constitution protects your rights.
It isn't an old, fading piece of paper.
It's a living document.
The Constitution says there are 3 branches of government.
So we're kind of like the 4th branch of government.
We are the future of America.
Find out how you could become part of Constitution Day.
For me.
For all.
For real.
Constitution Day is every day.
Minds can achieve anything. We make sure they get to college. Federal student aid provides more than $150 billion in grants, loans, and work-study funds to make college possible for anyone with the mind to get there. Because if given the chance, minds will do great things. Federal Student Aid, proud sponsor of the American Mind. Learn more about money for college at studentaid.gov.
Hi, welcome back to Straight Talk. We're talking with Karen Moore, who is a social worker, an addictions expert, a therapist, works with addicts all the time. And she's telling us some frightening things about what we already hear about. Prescription drug addiction, heroin addiction, what people are doing to get drugs, how they're getting hooked, and we're learning a lot. So hopefully you're paying attention because this information may help you or someone that you care about. Karen, let's keep talking about this because the role of physicians, because when we talk about prescription drug abuse, we're not talking about drugs coming in from Bolivia and Peru and Mexico.
No.
We're talking about drugs that we get from our doctors. And we trust doctors,
Correct.
especially our senior citizens. I mean, they totally trust doctors.
They have to.
So, you know, so we believe what they tell us. And they're giving us some of these drugs. And as you said earlier, they're getting addicted. What's the role of the physician that they should do? If you had your druthers.
Yeah, I mean, I think an important part of being a physician is being educated about what you are prescribing and is it correct to prescribe this to this particular person. Like actually getting to know your patient. I mean, if you are going to take someone with a long history, family history of addiction, and put them on an opiate, you are taking a risk of that person potentially having addiction come from being on that prescription. And are there other alternatives? Being very aware of what you are prescribing and how much you're prescribing, and is this person really needing this prescription? I think there is a tendency in our society to say, oh, you have a little issue, here's a pill. Let's make it better. Instead of actually getting to know the person and finding out, like, maybe they don't need something as strong and as potential to have an addiction come from
I mean, this prescription drug problem came from somewhere. You know, if we were looking at heroin or cocaine, we would be blaming, you know, a different country for shipping in these drugs or the drug gangs. But prescription drugs are coming from our doctors. And as you said in the first segment, that people are going to get addicted no matter what, legitimately, then the question becomes, how do we get them off? And if the physicians aren't doing it, these people are out there on their own.
Absolutely. I mean, what we'll see is that, you know, you'll take someone who gets on opiates. They have a legit pain issue. They go to their doctor. They get prescribed. They love it. For whatever reason is the answer to all their problems, all their stress, all their pain, everything's gone. They feel completely numb and they feel wonderful. And they want more. They will seek out another doctor. Well, you know, I need a little bit more. This doctor's not prescribing enough, and they will start to doctor shop.
Doctor
that's what
shopping,
they call it.
that's where they come from.
Doctor shopping is what they call it. And, you know, over time, doctors can become aware that this is happening and they cut them off, just like that. And this person is left with completely going to go into withdrawal, is going to be incredibly sick, and then you're left with a person completely addicted with no resources. Where do you think they're going to go? They'll go to the streets, they'll find more prescription drugs than
And that's where we're seeing this heroin increase.
Of course.
A lot are coming from prescription drugs.
Yes.
And then they go to heroin, and they don't probably, you know, the purity is up, the quality is up, and people are overdosing like crazy. But I read that more people actually overdose from prescription drugs than from heroin.
That's correct.
And people are talking only about heroin. When we talk about this epidemic of heroin, it's really an epidemic of prescription drugs.
Absolutely.
Sounds like. It's unbelievable. And we're looking at all ages.
Yeah, it's
you're in the business.
Ages.
You treat people. Is that what you're seeing?
All ages. You know, we don't treat the adolescent population, but, you know, from 18 up to, I think our oldest patient has been maybe 75 years old. It's across the board, all ages.
It's amazing. I mean, our senior citizens, I mean, they get prescriptions for everything. And then they misuse it. And they're mixing them together, or they forget to take it, or they take too much.
Absolutely. Well, with age, obviously, comes more medical issues and also the potential for cognitive decline, where they're going to take their medications inappropriately. They might have drug interactions. Also, we found that drug interactions can cause like adverse reactions, and then the doctors will treat the adverse reactions with something else, and they end up like really physically harming these people, not really taking a look at what's going on with them.
When we talk about our seniors, they really trust doctors a lot. So as we keep talking about this, it just seems that there's more and more responsibility falling on our physicians. And maybe we need to educate them more, or have them link in with a drug treatment center, something. But also the role of the patient. Maybe they need to ask, like, doctor, I'm going to get this surgery. What are you going to give me for my pain?
Absolutely.
Because it's really about pain, isn't it?
Yeah, I mean, I think it's also, you know, we put a lot on the doctors too, but it's also the role of you. You're going to be putting things into your body to ask the questions. What's the likelihood that this medication could harm me? What's the likelihood of addiction? Could I get dependent on it? What does it mean? What happens to my body? And kind of being a collaborative effort with a doctor to make sure that you are just as informed as they are educating you.
So questions that the patient, I mean, hopefully they'll be listening to shows like this and learning that when you go in for surgery or when you have pain, I mean, I think it's really about pain, and you want relief from the pain, you're going to end up getting a narcotic.
Correct.
You're going to get something that could be addictive.
Yes.
Be aware of it. You need to understand that.
Exactly. Understanding the risks that you're taking when you do have a surgery, you know, knowing what it does to you physiologically and like how long does it take to become dependent on it? How long do you really need it? And really being educated yourself to not set yourself up to take too many risks if you do in fact need to go on a narcotic medication.
Because that addiction then takes over.
It takes over.
And then you're in trouble. Great. Okay, we're going to take another break. I want to talk about treatment. What do we do to help those people?
Absolutely.
When we come back. We're talking about opiate addiction. We're talking about how do we help those people that we love or care about not get addicted when they go to the doctor for pain pills. So stay with us. We're coming right back to Straight Talk.
This is Anthony. Anthony is wanted everywhere.
Anthony's on my team. Oh, he's on my team.
Anthony?
5.
Good answer.
Anthony, will you sit here and play for me?
Sure.
Yes, Anthony is wanted everywhere. Well, almost everywhere. Because recently, when Anthony went with his parents to find a new place to live...
It's already rented.
I just spoke to this guy a half hour ago.
How can his parents tell him the color of their skin is keeping them from this apartment? It's not just unfair, it's illegal.
I'd like to file a complaint.
So Anthony's parents filed a housing discrimination complaint. And now they have a wonderful place to live. If you've been trying to buy or rent a home or apartment and you believe you've been discriminated against because of your race, color, religion, national origin, sex, familial status, or disability, call HUD at 1-800-669-9777 or visit hud.gov/fair housing. Fair housing is your right. Use it.
Do you want to know what it's like to be a teen? Let me tell you. Your so-called friends who you've grown up with and known forever have now decided that you are not worthy of their company. And the person that you're dating, well, they made it very clear that what they expect out of the relationship and what you expect are two very different things. And your parents, well, your parents, they worry about how you're doing in school, but sometimes they just don't get everything that you're going through. And your sister, well, gotta love family. She's decided that the only way she can exist and be happy in life is by making you miserable. Sure, it's not like this all the time, but enough that sometimes you need help. And that's why there's yourlifeyourvoice.org. 24/7, they're ready to talk, to listen, and to provide the help that you're looking for. They're always there, always ready. You want to change your life? Take the first step. It's your life. It's your voice. Use it. yourlifeyourvoice.org.
Hi, welcome back to Straight Talk. We're talking about opiate addiction, prescription drugs, heroin addiction. It's affecting every city in this country. It's affecting your city, your community. People you know, people you care about may be addicted. It's not the same stereotype of a heroin addict that you think about. We're with Karen Moore, who's telling us it's not just that. You are an expert. This is what you do. You see people who have drug problems every single day. When you have someone out there who got addicted because they had a back surgery or the doctor wrote a prescription and they don't understand what's going on, how do they get help? What should they do? Should they call a treatment center? Should they call a doctor? Who should they talk to?
Call a treatment center. I mean, if you're at the point where it's like you've tried to come off or you've tried to work with your doctor to try to come off and you realize that this is more than just physical dependence, like you really get a secondary gain, emotional, you know, gain from that drug and the pull is so strong, call a treatment center, have help getting off of it. You know, really learning about how to treat that addiction because it's kind of the only way to stay off of it is to look at why you liked it so much in the first place.
But when we talk about doing it yourself, probably not very successful.
Not very successful, unfortunately. You know, we see people, a lot of people try to do that, and they end up coming to us saying, I tried to do this a million times by myself, and it's just not working.
And so when you get somebody with opiate addiction, how do you get them, how do you get them off?
One of the things that we do use, we'll do a Suboxone, sort of a detox protocol, so to speak, and like have them, it's a, a blocker mixed with an opiate, and it allows them basically to not go experience the withdrawal symptoms. So it allows them a period of time to not go through the withdrawal, and as they taper down, they're able to not feel those really horrible effects that make them go seek the drug again in the first place. And so we'll do a kind of a brief detox on that and allow them to sort of get themselves off of it and then work on sort of the emotional things that have been going on with them that have them seeking it.
And the kind of treatment we talk about when we talk about heroin, you talk about Suboxone, it helps them get through that first period. But then when we talk about drug treatment, what do we talk about? Is it weekly, daily? What's the best, if you were to sit there and put together, well, you need to come in this many times, what's going to help somebody?
I mean, I think as far as drug treatment, as much as possible and for as long as possible. We do, several different things. We have a residential component. We have, an intensive outpatient. So that's 4 days a week, 3 hours a day. There's different things depending on the level of treatment that someone needs. But I would say the most successful people I've seen have stayed in the programs as long as possible and sort of reintegrated themselves back into their lives, made better relationships with their children, their husbands, their parents, their whoever it is, whatever, family members they have involved, in really trying to work with them on getting back into their life and being productive and not allowing the drug to steal everything that they've worked for.
Right. So seeing a counselor once a week for an hour probably isn't going to do it.
It's probably not going to do it. Lots of people like to think it would, though.
They do. I know, and that's what I think what happens is people go, well, I'm seeing a counselor, for an hour a week, but you're talking about somebody who is addicted.
Absolutely. And the benefit, too, of going to treatment is that you're around other people that are all experiencing something similar. Different drugs of choice, yes, but a similar... lots of similar behaviors, lots of similar feelings, and you get that sort of camaraderie of like, I'm not in this alone. And that's a really, really crucial part of the drug treatment.
I think with the awareness about heroin now, we have presidential candidates talking about their family members who've died, who've been addicted to different drugs. I mean, it just seems like, we've gotten rid of the denial out there, that people realize it's okay to say you have a problem or someone in your family. And now the next step is treatment. How do we get them help? Now, obviously there's probably not enough out there, but at the same time, they need to make that next step, and that's what people need to do. So what do you suggest? We've got people watching all over the country. Should they just look up a local treatment center, get in touch with a counselor, get an evaluation done? What?
I would say, yeah, even just getting an evaluation done. If you're concerned about a family member, really talking to them frankly about what's going on, what they observe. If it's the person themselves seeking it, of like at least getting an evaluation to find out what is available to you in your area. Sometimes people will leave their area because being close to home is too difficult. But really just accessing any treatment center that'd be willing to talk to you and get your foot in the door somewhere of someone who can help.
And that evaluation will help determine
what level of treatment.
Yeah.
How long you need to be, how much do you need per day? Do you need to be an inpatient? Do you need partial hospitalization? Do you need intensive outpatient? Someone who's a professional can tell you, what I'm seeing is probably that you need this level of care. And that's really helpful for someone to understand, like, wow, sometimes people don't realize just how bad it is.
And there's certified treatment centers all over the country, I would imagine.
Everywhere.
And getting that evaluation is like going to the hospital ER.
Correct.
And that you can't assume somebody needs residential inpatient before you do that. So the evaluation is number one.
Number one.
And then you need to follow through with whatever they recommend.
Exactly. The biggest thing is follow through. I mean, people come in so desperate, but then have difficulty sticking with a treatment protocol. So that's the one thing I can say. If you do end up getting a loved one into treatment, of really supporting them and saying you need to stick this out, because people will leave before they get a chance to really see that recovery is not this horrible thing, and that's actually really beautiful.
And the family's involved too, right?
Uh-huh. Yeah. We involve families 100%. You know, I think a lot of families, we see a ton of secrets. And people have protected the addiction or enabled the addiction, give money, you know, do things because they think they're helping. And in fact, they've just made it easier for the addict to keep going. So we really work with families on how to diminish that enabling behavior, to challenge not the person, not, you know, sometimes they'll feel like it's punishment, but we're challenging the addiction when we say, don't give them money, don't give them rides places, don't do these things. It's not helping them. We are challenging the addiction, so it makes it harder for them to keep it. And that's why it's really important to work with families, because a lot of times they don't know how to best help. So
yeah, they mean well.
They mean very well. But a lot of times with addiction, it goes against like every maternal and paternal instinct you could ever have in your life. What we tell people is, no, do not do those things, because you're actually enabling them to keep going.
Whatever it's called. Well, thank you. This is great information. You know, we've got a whole country out there that's suffering from this addiction, and this is hopefully some good information. Thank you so much.
You're welcome.
Today on Straight Talk, we took on the issue of opiate addiction, prescription drug addiction, heroin addiction, and wanted you to understand the problem and how to solve it. So now it's up to us. If you know someone or yourself has an issue with substance abuse, no matter what it is, pick up the phone, get on the internet, make a call, get help, get that evaluation, because it's not going to go away on its own. And we have a responsibility to try to help each other and help our families. So I want to thank Karen Moore, our guest, and thank you for watching Straight Talk, and we will see you next time.